Hello. I am so happy to share with you this quick overview on pelvic floor muscle relaxation, what it is, why you would want to do it, and how to do it. My contact info is here, my website, thrive-pt.com, and my 2 Instagram handles. And so getting right into it, a lot of people carry extra tension in their pelvic floor muscles. Same way certain people have tendencies to maybe hold tension in their jaw, upper traps, low back, and hips. A lot of people do tend to kind of grip. There are a lot of different reasons why. And some of it may be protective, some of it may be learned. Certainly when there is pain, the body can kind of grip in response. So how do I know? There are, of course, some people who may already have it identified that they have pelvic floor muscle tension, myalgia, overactive muscles, increased tone. There's lots of different names for it, but any kind of pelvic pain condition can definitely, it's not to say that if you have a pain condition, you definitely have extra tension, but it may, again, the body may kind of grip and guard as a mechanism. It's hard to chicken and the egg with it, but it definitely can cause pain too. So if you happen to have a pain condition, this may be a very beneficial practice for you, particularly for post-surgical pain or anytime you're feeling extra stress, extra tension, or extra pelvic floor symptoms. Constipation is another indicator that you may have an increased tone in your pelvic floor. And then some people, just tend to kind of be more uptight, both personality and kind of in their bodies. And there are a lot of different mechanisms behind it, but that just may be an indicator that some of these pelvic floor muscle relaxations may be beneficial for you. Just to note, all of this stuff is really based on anecdote and based on clinical practice. We don't have much empirical data on the best way to perform pelvic floor muscle relaxation practices. So these are just lots of options for you to play around with, see what works for you, and know that there's no one right way and there's a lot of different ways to do it. Okay, so it is a fairly low risk practice. But this is not a substitute for medical advice, as my disclaimer. So gold standard kind of would be to get checked internally by a pelvic health therapist, either PT or OT. And, but many don't want to have that or are unable to access it. So I say, get to know your own body. And I have a lot of tips for you here to help figure that out. So 3 things to start to think about are, one is pelvic drops. So what this is an intentional checking in with your pelvic floor muscles throughout the day and dropping them down or letting them kind of relax. You may not really feel it right at first, and that's okay. Don't feel like you're doing anything wrong. If you don't feel it 100%, it's subtle. Okay, so some of these practices will help you connect to your pelvic floor and maybe understand and be a little bit more aware of what's going on. And that's what Pelvic Drops is. It's an awareness practice that is aimed at recalibrating and trying to create a little bit more of an automatic relaxation practice for you. So maybe you don't hold as much tension there, and that can help improve a lot of symptoms. And I didn't mention, but many people who have pelvic floor symptoms such as urinary leaking, or urgency, frequency, and even pain with intercourse. Those are other things that sometimes people think may be a strength issue, particularly for urinary leaking, or even leaking gas, queefs, things like that. But sometimes they can be from the muscles being too tight. And if you think about the bicep and you think about this muscle staying short and tight all day, when you actually want to use it and you go to try to stretch it out, it's not going to be very happy, right? So it's not going to be able to function optimally. So that is what this can be helpful for, is allowing the muscles to move through their full range of motion so that they can work optimally for what we want them for, which is helping facilitate movement, helping to hold in our pee and poop and let it out when we want to, helping with reproductive and sex functions, and all the other things that the pelvic floor really can help with. So coming back to these numbers 1, 2, and 3 here, some movements that help you lengthen your pelvic floor muscles are deep squats, and I have pictures of these coming up in a moment, happy baby, supine butterfly, and then another tip is to use your breath. So you can try this even in quadruped or hands and knees position, in laying, prone on your tummy, laying on your back with your feet up, legs up the wall. So there's a lot of different ways. And then you can even envision and begin to use those visual cues for melting into the floor. So here are some photos. These are not every single different position. I mentioned some just a moment ago that are not included here, but this deep squat on the top left is a yoga posture, but you can certainly take it out of the yoga and use it individually. And this really helps gravity or uses gravity to help stretch the pelvic floor muscles, and the wide-legged position can also help with that. If it is difficult for you to get down into this position for whatever joint limitations or strength limitations, you can use the wall and kind of slide down as deeply as you can. You can also sit on a low stool or even some stacks of yoga blocks or stack of books even, and then get those elbows into the knees and do some deep breathing, visualization, and the relaxation practice here in this position. This other one, the kettlebell, she's actually using a heavy weight to help even facilitate that stretch a little bit more. So you can use that as an option. That's, I would say, probably a little bit more advanced. So better to have a good awareness of what's going on with your pelvic floor with some of those more weighted practice. And then I have a happy baby here over on the right. And he's in actually a good happy baby position, but you can also grab outside of the feet or on the inside. It really doesn't matter where you grab it, pulling those legs apart. And again, breathing deeply into the pelvic floor and letting it relax and stretch. Standing, this is a seated butterfly position, but you can also lay down, recline on your back, and let your knees fall out to the side. You can even support with pillows and really get in a nice comfy position and do some deep breathing for a couple of minutes and really just relax into the pelvic floor. So let's actually practice. So again, doesn't matter what position, there's lots of different things to try. So whatever position you're in, you can try it that way. Some other things to think about is to boost kind of some of that sensory feedback that can help you kind of connect and know, am I actually doing this relaxation thing? Placing a rolled up towel and sitting at your perineum, which so actually you would sit on it kind of long ways. And that will kind of push a little bit of pressure up and help you kind of maybe feel some of the muscles relaxing over that towel. You can just reach down with the palm of your hand with kind of the flat surface of your hand. And you would just place your hand just right over the top of your genitals. For people with a penis, you would just reach right underneath your scrotum and kind of feel those muscles kind of around the anus and between those sit bones, and feeling the muscle giving that input from your hands. You may feel it in your hands, but it may also just help you kind of feel it in your pelvic floor. So, and then I do encourage you also, when you have more time, to try it unclothed with a mirror. Can you feel the contraction? Can you see it? Can you see the relaxation? And just get to know your body and be more comfortable with it. Okay, so let's practice. Wherever you are, close your eyes just for a few minutes. Take a deep, big inhale, slow but gentle and full. And see if you can feel that breath go down into your pelvic floor. So continue to breathe deeply And gently, and a soft exhale, breathe deep. And if you would like to on the exhale, you can do a gentle contraction. Sometimes the contraction can help us with the relaxation part. Okay, same way sometimes having tension in the shoulder, you can feel the squeeze and then let it drop. Same thing can happen with the pelvic floor, so you can squeeze gently and then drop those muscles down. So if you didn't feel it, it's okay. Try some of the different position options. Let me know how it goes. And then here are some other resources for you. Anthony Lowe, the physio detective on YouTube, has a color relaxation, and this is not specifically pelvic floor, pelvic health, but that is another relaxation, guided relaxation that you can do. And that can be helpful for total body relaxation, really. And then Nari Clemens, who's a pelvic health physio here in the States, she has a whole YouTube series. If you search up meditations for pelvic health, there's some wonderful guided meditations in there as well. And don't forget to connect with me on Instagram at terry.elder.dpt and let me know how you found this.